From the Carter Subaru Studios, this is the Gee and Ursula Show with G. Scott and Ursula Reutin.
Good morning. Happy Tuesday, and thank you for listening to the Gee and Ursula Show. Good morning, Ursula.
Good morning, G. Happy Tuesday.
Good. How was that 9 o'clock hour of the show? What you think?
It was good, informative, heavy. A lot of people had a lot of questions, a lot of commentary. So we're going to continue our conversations this hour as well. And just a reminder, President Biden is expected to speak. Initially, he was going to speak at around 10:30, and that has been pushed back to about 11:45. So we will take it live when it happens. I suspect it might be pushed back again because he has been starting late each time, but we'll see. We'll keep you posted on that.
Right. Well, let's get to it. Let's get to the top 3 things that you all need to know at 10.
Number 1.
So up until recently, we were told that we need to get to 70 to 80% of people fully vaccinated before we can reach herd immunity. But now doctors say that number is higher because of the Delta variant. It's much more contagious, they say.
While people might have heard before, well, we need about 67% or so of us fully vaccinated of the entire population, not of eligible people. Now that math has changed a lot. And so we're now talking about 85 to 90%.
That is Dr. Mark Johnson with Wenatchee's Confluence Health. He says, again, that's because the Delta variant is much more contagious than other strains.
We are asking the immune system of fully vaccinated people to do too much for our communities. We can reasonably predict until we get enough of us vaccinated, this virus will continue to mutate.
Reporter Nicole Jennings was at the Washington Hospital Association briefing yesterday where the doctors made these comments. And Nicole joins us live now. Good morning, Nicole.
Good morning.
So let's get right into it. Explain a little bit more now why. I always had the 70% or even 80% figure, but now we're saying higher than that. Explain why.
It's because of what we've seen in the last month. Our hospitals are inundated with people who are not vaccinated. It's nearly everyone in the hospitals right now with COVID is unvaccinated. And so clearly, even having 70% of us vaccinated, which we hit back in July, is clearly not enough to stop this Delta variant in its tracks. And now we're hearing about other possible variants. I mean, this is just going to keep mutating. We're hearing about that one in South Africa, the Lambda variant, I think, or is that a different one? And we're just looking at this repeating itself in a cycle for the next couple of years until we get enough people vaccinated. And clearly with these more aggressive, more contagious variants, 70% is not going to do it. We need, basically everyone, all adults. And they're saying 85 to 90% of the entire population. So if you take out of the entire population, you take out the kids, and that's looking at just about every adult.
Well, I thought I was coming into this segment with some good news, considering that as of right now, 73.3% of everyone in the state of Washington, 12 years and up, are vaccinated. So that's where the state of Washington holds true. Let's talk about this. Right now, I was reading what you've been talking about lately, and Chief Physician Officer with Multicare Health System, Dr. Dave Carlson, he was a part of that. He said that there are roughly 275 patients right now with COVID-19 in multi-care hospitals. If 100% of those people were vaccinated, he said that number could be about 10 to 12 patients if they were vaccinated. Talk about some of the stories and what you have been hearing about just how taxed our hospitals are right now.
Oh, my goodness. Well, and I've been talking about this for a couple of months now, but the staffing levels at hospitals are absolutely strained because doctors and nurses have been quitting with burnout after a year and a half of this unimaginably difficult work. And then at the same time, the hospitals are just being overrun with all of these COVID patients. And the doctors did observe yesterday kind of wryly that it's funny that people don't trust the medicine in the vaccine. But then when it comes time to get the life-saving drugs that you need to treat COVID, then they're the first ones in line at the hospital. So that's kind of ironic, but it's just heartbreaking. I mean, I actually was tearing up watching this press briefing, especially when they were talking about pregnant women, as you just heard in Heather's newscast. They are seeing 5 times more pregnant women with COVID in the ICU than before. And a lot of that is unfortunately due to these myths and misinformation that's spreading about the vaccine causing infertility, which is, there's no truth to that. And what's happening then is pregnant women have a much, much lower vaccination rate than the general population. It's around 40%. And so as they were saying yesterday, 40% and 90% are very different. And that means they're just so much more susceptible to the Delta variant. And this, I mean, this is just causing such terrible problems for them. Their babies are being born prematurely. In some cases, they have to deliver the baby early because the mother wouldn't be alive to give birth, or mothers are dying on the day that they give birth. It should be the happiest day of your life, and instead you're dying and leaving the child there without a mother. I mean, these stories are just, they're enough to bring you to tears. And it's so unnecessary, is what they were stressing yesterday, is that these, as he said, the 275 versus the 10 patients, these would not have to happen. This is preventable in most cases.
Nicole, I've got to tell you, as you're speaking, I am looking, frankly, at our text line because it's ironic to me. It's a sad irony, frankly, that the more you talk about what the people who work in the hospitals are telling us and letting us know, you know, the struggles that they're dealing with. You know, people are texting us or emailing us talking about how they know a nurse or their wife is a nurse, and these are all lies, and it's not, you know, as bad, and we're trying to scare people. I mean, we cannot go into a hospital right now unless we are a patient. I mean, you should know that, which is different. So we cannot see for ourselves other than when we are invited, and our news partner has been invited, other news organizations have been invited. We do have to go with what we are being told by doctors, but there is just a segment of the population that is going to look at this and say, well, and I understand the part about feeling like the goalpost keeps changing. If every single adult needs to be vaccinated, it's never going to happen, and we aren't going to reach it. We're just not going to reach it. So, you know, shoot for the moon, but it's not going to happen.
No, and that's the problem. I mean, if you remember when the Department of Health was having its weekly briefings back in May and June, every single week it was celebrating, okay, we're at 65%, okay, we're at 66%, and then it got up to, oh, we're at 69.1, 69.4. I mean, they were celebrating these little incremental victories. So if it was that much of a struggle to get to 70, no, we're not going to get to 85 or 90. That's not going to happen. That's what really worries me, though, is that all of a sudden, I had thought that we were going to be done with this thing by this summer, and now it's looking like they're actually using the word years to talk about this, and it doesn't seem like there's a way out.
Okay, Nicole, I appreciate it. Is there anything else that you feel is really important for us to know? I mean, I know that elective surgeries are being canceled in many cases. Mm-hmm.
Yes, and that is not just facelifts, cosmetic surgery. That is, I can tell you, when my mom had a hip replacement, she was in excruciating pain, and she was so excited to get that surgery because it completely changed her life. And now someone like her who needs that surgery to be able to live in comfort wouldn't be able to get that. This is hip replacements. This is reverse colonoscopies. I mean, this is things that you wouldn't think of as just elective. It's not luxury surgeries.
I appreciate your reporting on this, Nicole. I'm just going to put a call out to any nurse or doctor who is in an empty hospital who can confirm to us any of these claims, because I am sick and tired of people trying to say that we are manufacturing information right now. We're trying to help you.
Can I raise my hand on something?
Yeah.
Earlier in the 9 o'clock hour, we were talking about the Washington State Fair. And I said, hey, I think it should still continue. I think it should still happen. People have the people that are vaccinated, people kind of know by now. We want people to be able to still make money, and the vendors and all that kind of stuff. And I'm not saying that my mind has changed, because I'm kind of really still thinking it through. But I got a message from a personal friend of mine that works in the hospital and heard me say that and wanted me to really understand like what I'm saying. And do I understand what I'm saying by continuing to want these big events? And it's on top of what you just said, Ursula, wanting these big events and saying, yes, okay, yes, a lot of the people that are in the hospital, most of them are unvaccinated, no doubt about it. But you do have to understand that because of this will, like you and Nicole were talking about, this will cause delay for those that are coming to the hospital for something else other, not really even related to COVID. So I'm rethinking my decision on that one, Ursula.
My gut reaction right now is if they continue with these big events, require the COVID passport, require showing your COVID vaccination status, or require wearing a mask. You can't have it all ways. So, and I'm not being a hypocrite because I am going out and I am doing these things. But guess what? I will wear a mask outdoors if it helps me. And I'll own it and not feel embarrassed and not worry about it. Mm-hmm. I had someone say, hey, take off your mask because you're taking a picture. And we've done that. But again, we need to do the best that we can. I'm going to believe, I'm not going to think that this is a lie that people are saying, the doctors are saying, and I've yet to have someone reach out and say, I'm a doctor with an empty hospital. That has yet to happen. But I did get several texts saying, yes, I am a nurse, and yes, it is very full, and it is full with COVID patients. So if you can show me those empty hospitals where your wife is working or where someone's working, and I'm not talking, obviously, if they're working in a completely different field that has nothing to do with COVID, sure. But we're talking about what doctors and nurses are facing right now, heading into what is likely going to be a season when we're going to have an increase in cases just by what's going to go on. Schools reopening. And we've said schools need to reopen. But it's so frustrating to and I get it. You know, you want your choice. I get it. There are some people who cannot get the vaccine. And for them, you are exempt. But we are in a situation where
724 sends a text. My dad is in the hospital not due to COVID, but chest pains. He had to wait to be put in the ICU overflow due to the ICU full due to COVID patients not vaccinated. Here's a person who needs a bed due to the neglect of people. He had to wait. Why? This should not happen.
Exactly. So, in any case, we're gonna change it up. We gotta lighten it up right now. We got
the rest of the way. The rest of this show, no Afghanistan and no COVID.